So let's talk about a condition that is misunderstood, underdiagnosed, and often misdiagnosed and called anxiety. So I'm Tiffany, I'm a physician assistant, but I'm also a GLP-1 advocate. So I spend a lot of time helping people get access to GLP-1s that cannot get them through traditional insurance. So if that's something that you're struggling with, there are some links over here in my bio that hopefully can help you out. Okay, so what is this mystery syndrome? It's called POTS. Now POTS is short for Postural, Orthostatic, Tachycardia syndrome. And it's very possible that you might have it and just not even know about it. So POTS is actually a dysfunction of what we call your autonomic nervous system. So your autonomic nervous system is things like your blood pressure, your heart rate, and your digestion. It's the things that are controlled within your body that you really don't even have to think about. So normally when you go to stand up, gravity pulls blood down into your legs. Your autonomic nervous system, if it's working properly, will tighten up the blood vessels in your legs so that the blood does not pool up down there and all run down to your legs and make you lightheaded. And it can be normal for your heart rate to raise just slightly, also to help keep the blood pumping to your head when you first stand up. But when somebody has POTS, that adjustment does not happen efficiently. So that person, when they go to stand up, their heart rate usually increases quite a bit, up to 30 beats a minute, and their blood pressure will sometimes drop out on them. So between 1 and 3 million people in the United States have this disorder, and women are especially prone to this, especially women who are younger, between the ages of 15 and 50 are more likely to be diagnosed. We don't exactly know what causes it, but we do know that certain traumas or illnesses can actually trigger it. So things like surgery, viral illnesses, pregnancy, and other trauma that happens to your body can actually trigger this to come. So even if you've never had it before, sometimes it can come on later in life. So the symptoms can vary, but some of the most common symptoms that I hear people complain of is elevated heart rate, especially when you go to stand, dizziness, lightheadedness, brain fog, cold hands and feet, and often feeling like you might faint. Now, symptoms tend to get worse in the heat. They tend to get worse when you're standing still or when you're on your menstrual cycle. And unfortunately, a lot of times for women, these symptoms get blown off and misdiagnosed as anxiety. So this is hard to diagnose. There's not a single blood test, but there's a few tests that we can do that give us an idea if maybe you're suffering from POTS. So there's something called a tilt table test that tests your blood pressure readings when you're lying and in a standing position. And then we can also do some testing where you do a 10-minute standing test and we check your blood pressure. Now, when you go to stand up, if your heart rate increases more than 30 beats a minute within the first 10 minutes of standing, that test is pretty diagnostic for POTS, but not 100%. Okay, so all those, there's no cure. Management can help a lot with your symptoms. So people have to hydrate. So important, because if you don't hydrate, your symptoms can be much worse. People with POTS actually have to add salt to their food or add salt to their diet. That does actually help keep water around. So you will see that as a management recommendation. Compression stockings worn on the legs a lot of times help the blood from pooling up when you go to stand up. So oftentimes people do that. And then eating small, frequent meals, because when people eat a big, large meal, that digestion can be hard on the autonomic nervous system and actually exacerbate your symptoms. So if symptoms get severe, then there are some medications we use for management, but again, there is no cure. So if you're feeling dismissed, just know that POTS is real, it's not just anxiety, and you may need to see a provider who is familiar with these symptoms because it is super underdiagnosed. So let me know in the comments if this is something that you have struggled with or struggled to get diagnosed.